Alright, next is the quadriceps anatomy. Now, the quadriceps muscles is basically a group of 4 muscles that consist of the rectus femoris, the vastus intermedius, vastus lateralis, and vastus medialis. Okay, so we're gonna talk about the rectus femoris, which is one of the biggest ones. So the rectus femoris has 2 heads. You got the straight head and you got the reflector head. The straight head originates from the anterior inferior iliac spine of the pelvis, while the reflector head originates from the supraacetabular groove of the pelvis. Now, the groove is actually superior to the acetabulum of the pelvis as well, okay? Now, how does the rectus femoris insert itself at the patellar tendon? So, the rectus femoris runs down the anterior thigh and inserts itself at the superficial patella via the quadriceps tendon, where it slowly runs between the distal ends of the rectus femoris and slowly inserts itself at the patellar tendon, inserting into the tibia tuberosity. Next muscle is basically called the vastus medialis. The vastus medialis is basically a muscle that kind of is found on the medial side of the anterior thigh. This muscle actually originates from the intertrochanter line of the femur, more on the proximal side. It also originates itself at the linear aspia of the femur, running down the femur. Okay. Now the vastus medialis muscle basically inserts itself at the medial quadriceps tendon, where it slowly inserts itself at the patellar tendon, inserting into the tibia tuberosity. Next muscle is called the vastus lateralis. The vastus lateralis is a muscle that is found on the lateral side of your anterior thigh. Now, this muscle originates at the greater trochanter of the femur, as well as the linear aspia of the femur as well. And it basically runs down the lateral side of the anterior thigh and inserts itself at the lateral quadriceps tendon, where it slowly inserts itself at the patellar tendon, inserting into the tibia tuberosity. Next muscle is called the vastus medialis. The vastus medialis is located at the center of the quadriceps. It's just right under the rectus femoris, so it's a deep muscle behind the rectus femoris. Now, the vastus intermedius originates from the anterior surface of the femoral shaft, which is basically a bone landmark on the femur. If you look closely into the anatomy of the bone landmarks, you actually can see it. Okay, so it basically runs down the anterior thigh and inserts itself at the quadriceps tendon, where it slowly inserts into the patellar tendon, inserting into the tibia tuberosity. Now, the quadriceps muscles itself, right, is a key muscle that helps with leg extensions or knee extensions. Okay. Now, the extensor mechanics is actually the quadriceps tendon, the patellar tendon at the patella or the kneecap. If any one of these structures get injured, patients won't be able to do a full leg raise, knee extension, knee flexion, or any other knee movements. Now, common condition you also can get is basically patellar tendinopathy, or known as Joplin's knee. Patellar tendinopathy is a condition due to repetitive movement of the patella, or a cause of overuse as well. It causes small microscopic tears in the tendon, which can lead to inflammation, which can lead to pain, instability, pressure-like feeling, sometimes a burning feeling, and because it is caused due to overuse, such as could be caused in athletes such as basketball players, long jumpers, or even could be an overuse of your favorite sports that you play. Now, some people would feel pain on the midline of the patellar tendon, but some people would feel more on the incision point of the patellar tendon, where the tibia tuberosity is at. Now, there's also another condition known as Osgood scatters. Osgood scatters is basically a condition due to repetitive movement of the patellar tendon, which causes inflammation of the growth plate at the tibia tuberosity. Now, this could happen because of injuries or basically repetitive extensions of overuse, which could cause marked swelling, pain, inflammation, tenderness, and basically instability as well. Okay, so it is more commonly found in teenagers who play actively in sports as well, because of due to repetitive movement of your legs, like playing soccer as well. Age also comes in a factor of this. If you are older, your growth plate, the bones, are actually more mature, meaning they have fully grown already. But for teenagers, their bones are still growing, and if you kind of injure it, you've kind of injured the growth plate for teenagers, right? Because the growth plate is still growing. They're a bit immature, and they're not fully developed yet. Okay, so this could really like develop a condition known as osteoarthritis. This is not really like a very good explanation for osteoarthritis because I haven't really done a lot of research on this condition itself, but these are some factor points of the osteoarthritis condition. So the quadriceps muscle nerve supply is actually called the femoral nerve, and the femoral nerve originates from the basically the lumbar spine. Okay, it originates from the lumbar spine of L2, 3, and 4. Okay, so always remember that L3 is basically associated for knee extension. L3 actually carries a huge volume of the femoral nerve. Okay, doctors can actually do this test called the knee reflux test. It's basically where they actually use a hammer and they actually hit your patella tendon, and the nerve actually gets hit, and your knee basically kind of like flicks up as like kind of like a shock. So they actually want to test the lumbar spine of L3 and 4 as well.